Welcome to Neurodegeneration Awareness and AI, a podcast where we explore overlap of neurodegeneration awareness and artificial intelligence. I'm Sukant Purana. With me, there are some neuroscience and AI students and a professor. I'll talk to them as we go along. First one is Sohed, who's a AI and biotechnology researcher and a young student. Sohed, let's begin with the big picture. So rural Africa has profound shortage of neurologists and diagnostic infrastructure. Can you set the stage for our listeners? What does a typical journey look like for a rural Parkinson's patient, and why is mobile first AI such a promising disruptor?
Yeah, thank you, Dr. Sukant. The reality is stark. In many African regions, a rural patient with early Parkinson's symptoms that may never see a neurologist. Most primary care workers lack training, and even basic diagnostic tools are rare. So, mobile first AI can change this. With smartphones, we can analyze speech or movement patterns to flag early signs. Even a community health worker can now screen for neurological issues using AI-powered mobile tools. Yeah.
Thank you, Sohed. Kanak, what are the main infrastructural and cultural barriers to deploying mobile health tools in these settings, and how are they being addressed?
Yeah, so key barriers include poor internet, unreliable electricity, and tech uncertainty. And also, the AI tools must work offline, be energy efficient, and designed with local language and visuals. Also, the community partnerships are essential, and the engagement with village leaders and adapting tools to local customs increases acceptance.
Okay, thank you. Aditya, what are the main promising AI-driven diagnostic approaches for Parkinson's that are realistically deployable on mobile platforms in Africa?
Smartphones already have powerful sensors. We use voice recordings to detect speech irregularities, drawing tasks to track tremors, and portable EEGs for brain signals. These models are lightweight, offline ready, and have shown over 90% diagnostic accuracy in pilot studies. The goal is early screening, not replacement of doctors, but empowerment.
So, here's from a technical standpoint, what adaptations make these AI tools work in low-resource environments?
Yeah, so we use model pruning and quantization to make neural networks smaller and faster. Runs locally, and data uploads only when there is an internet connection. And we also use federated learning for privacy, and interfaces include icons and audio in native languages so that non-specialists can use them easily.
Okay, thank you. Sahil, how do mobile-first AI tools impact the confidence and capabilities of rural healthcare workers?
Yeah. So they feel empowered with AI. They can detect subtle symptoms confidently and refer patients sooner. So many become community champions for neurological health. It also boosts morals and connects them with wider networks of training and support. And in addition, we track the effects of these deployments, monitoring metrics like screening rates, diagnostic accuracy, and patient outcomes ensures we are improving care continuously. And health workers provide feedback that helps us enhance both tools and training over time.
Aditya, could you elaborate on how this feedback loop contributes to protect sustainability?
Certainly, sir. Ongoing evaluations help secure funding and community trust. We measure real world outcomes, for example, referral rates, treatment initiations, and user satisfaction. This data driven refinement process ensures the tools remain relevant and responsive to on ground realities. It's a core part of maintaining both impact and accountability.
That's really good. Um, so, Dr. Kaniz, how can AI assist in monitoring post-diagnosis support in this rural context? And please discuss in the context of awareness, this whole medication and post-diagnosis.
So AI is helping Parkinson patients manage their condition with simple and affordable tools, such as medication reminders using basic SMS, WhatsApp alert in local languages. Then it can even monitor symptoms through voice recording, detecting subtle changes in the speech that may signal worsening of tremor. And then there are low cost variables which help community health worker to gather real time motor data. So these solutions not only improve continuity of care, but make it truly accessible and personalized in underserved areas.
Yeah. So you mentioned Parkinson's. There are others also, but let's just go further. Like, obviously there's Alzheimer's, Huntington's, and all, but let's go with potential of AI in optimizing um, drug delivery and other things in low resource settings. What do you think about it?
So AI can help identify which drug work best in local context. Then it can also analyze regional Parkinson patient data to determine most effective treatment or most effective formulation for them. Then it can suggest simplified dosing regimen based on patient specific data. It can also support supply chain prediction to prevent stockouts in rural clinic. So combine then there is, nanotech delivery method, which help to increase or improve the pharmacokinetic, reduce the side effect, and significantly improve long-term compliance.
Well, that one has to see where how much of nanotech is actually making an impact, because so far there has been some success, but it's been limited. But let's move on to some interesting aspects with essentially ethics, right? So then shifting to ethics, how can we align AI tools with local cultural values in African settings?
Yeah, so most AI ethics are based on individual autonomy, but in Africa, community well-being matters more. We need a community consent, not just individual. Local leaders should help define data sharing norms. Without this, we risk losing trust and killing the communities we want to help.
Well, that's really good. Thank you, all of you guys. It's really very nice to hear from all of you on this regard. And stay tuned for our episodes to understand how neurodegeneration awareness is changing across the world and how it is changing with help of AI. Thank you for listening. Please subscribe, like, and share. Bye bye for this time.